First thing I want to do is just welcome everybody to Rio TV again. We have another exciting week lined up full of masterclasses and all sorts of cool things. So check the schedule, go into the schedule to see what that episode's about and join us. We love to have you on. This morning, I have Phillip Viljoen, someone I've known for many years and have been very admiring of the work that he has done since I've known him. In the realm of children with autism and a therapeutic method called ABA, which I still don't fully understand, but maybe Phillip can help us understand it a little better. So welcome to the show, Phillip.
Thank you. Yeah, and I'll do my best to make it as understandable as possible.
And you are zooming into us from somewhere in Pretoria, am I right?
Yeah, that's right. I live in Centurion. So I'm zooming from my living room, yeah.
Okay, fantastic. Okay, so Phillip, I think just as a quick introduction, who are you and why would we be listening to you specifically about children with autism? Give us a bit of a sense of your career in this field and why you're effectively an expert at what we're talking about now.
Well, assuming the people that logged in to listen, they don't know any of my expertise yet, so they've got their own reasons why they're listening to me right now. But yeah, let me get into it. So I studied psychology. I've got an honors in psychology, but that's really beside the point, I feel, because mostly my experience of autism comes from the last 9 years, in which I've been trained and been doing ABA. With children with autism and some other individuals as well, including adults. Yeah, I've got a degree through or a diploma through Florida University of Technology there in ABA, and it's basically. Most of my training comes through on-the-job training that I've been doing, working with very experienced and very skilled people. We work in teams, and I've worked with a variety of children. I think the number of individuals that I've worked with has been 40 or 50, most of those, with a diagnosis of autism.
Okay. And can you tell us a little bit about ABA? What does the acronym stand for, and what kind of a therapy is it?
Yeah, okay. So ABA stands for Applied Behavioral Analysis. It's a behavioral therapy. I tend to think of it as a extremely powerful teaching tool. So what it is, it takes the principles of behavior, which have kind of been scientifically determined. So there's a lot of research that goes into it. There's a lot of testing that goes into it. We don't use anything which doesn't have a firm grounding in reality, which is somewhat different, I would say, than other psychological methods, because simply because when other psychologists approach a situation, they're really more looking at how best is this person going to respond to what I provide to them, and you can correct me if you're wrong, Deon, you actually have more knowledge in that than I do. But that's the impression I get. When it comes to ABA, even though we do that, and it's very individually based, it's based on the particular client that you work on, what kind of intervention you'll be giving. It's also based in this very scientific approach. So we, as an ABA provider, I can't actually do something that doesn't have enough science behind it to really prove that it works. And we do that for ethical reasons, so that we know that we are providing the best possible care to that client. So that's just kind of the background where it's coming from. If you do want to find out more about it, you can look at the work of B.F. Skinner. He's really the guy the kind of grandfather of all of this. And in his words, he created ABA to save the world. Which I think is great.
So last month, I did a module, a great courses module on CBT, which is closely related, behavioral therapy. And I was very impressed with the very cause and effect. Like, these are the statistics. Apply this, and here are the results. It's a very, very highly results-driven way of thinking about therapy. It's not kind of pink and fluffy. It's not kind of this might or might not work. It has a proven track record, and I have to say that appeals. That appeals in that obviously parents dealing with kids with autism have some very specific real life issues that they're dealing with, and I guess you're not looking for fluffy responses to that. You're looking for very concrete solutions for that.
Absolutely, yeah.
So let's talk about autism now. First thing I have to ask you is, do vaccines cause autism?
No.
I had to throw that in because it has to be one of my biggest bugbears in life, is listening to anti-vaxxers absolutely poisoning the pool.
No, yeah, I mean, and as you well know, I was seeped in that culture for a long time. And until a few years ago, I absolutely, if you asked me that question then, I would have said, yeah, vaccines, evil, don't do that to your children. But kind of through my experience with autism, I slowly started to realize the truth of the matter. And I think I had an advantage because I'm trained to think in a very critical way through ABA. And I think that gave me the advantage to kind of realize what the truth behind it is. And if you'll let me, I'll go just really quickly into why, one of the reasons I think people do kind of believe in this vaccines called autism thing. And it comes down to, they have a child, they kind of, there's a grieving process that goes on when the child is diagnosed with autism. And I have my own kid who's 2 years old, and he's been going through his vaccine regimen. And it's so easy to kind of draw that cause and effect, or that, oh, well, he had a vaccine the one day, and then the next day, all of a sudden, these autism symptoms, which sometimes can appear like that, suddenly he loses all his words and he can't, he doesn't make eye contact anymore, and he's not communicating, and he's starting to engage in self-stimulatory behavior that happened. But then on the other side, the kind of bigger side of it is 1 in 59 children are being diagnosed with autism these days. So, and this is one of the first kind of, I would say, kind of propaganda, brainwashy things that I got exposed to is, look at this graph. Look how the prognosis is climbing. Look how many kids. Back in 1980, there were like maybe 1 in 1,000 kids that were receiving the diagnosis, and now it's 1 in 59. There must be some kind of cause. It's an epidemic. It's worldwide. And so people started looking for, why is this happening? And some people came to the conclusion that there's environmental effects. And one of those environmental effects is apparently vaccines. Yeah.
So I was looking at just the numbers. EOH has 7,000 people in it. That means there's around 200 children statistically that might have autism just within the realm of the parents of EOH. And so it's obviously a big problem. Well, it's a big thing. It has a large impact. Let's go into autism itself. So what is autism? Like, give us this, try and demystify autism for the layperson for us.
Sure. So that's almost easier said than done, because autism is a spectrum disorder. So it was interesting to me when you kind of gave that comparison. There'd be 200 kids with a diagnosis. If you look at those 200 kids, one of those children is going to differ very, hugely from another child. One of the kids might just have some problems socializing, making friends at school, maybe some academic problems, whereas the other kid is going to be 5 years old and they're still not going to have mastered saying a word. That's the kind of span that you can get in autism. And, I think these days we're getting a lot of exposure to people that identify as autistic and identify as on the spectrum, who are, loud voices, and they're speaking about their experiences and those sort of things. And these are people that, yeah, went through very severe challenges, but are very often not as severe as the diagnosis can get. So in many ways, the diagnosis is encapsulating a lot of a variety of problems. So, and to give you kind of an idea what generally you'd be seeing, once again, with every kid being quite different, is you'll see somebody who is not engaging with others, is not engaging with their environment, at least at the level that they should be. That's one of the biggest problems, because it means that they're not learning and they're not developing the skills that they need to function effectively within that environment. When you're looking at the most severe cases, you're looking at children that are not developing language, are not learning basic skills like toilet training, like taking care of themselves, are engaging in behaviors which are very detrimental to their development, such as aggression, such as intense tantrums, which may include self-injurious behavior, or even or stereotypical behavior, which is kind of these repetitive behaviors like hand flapping, which some children can engage in for hours and hours because it's very enjoyable to them. They're getting some kind of stimulation out of it. But if that's all that you're doing for hours and hours, you're not learning from your environment at all. You're just learning to flap your hands. On the kind of less severe side, you're looking at kids that are and individuals that have some problems making friends, that have problems kind of applying executive functioning skills such as planning and inhibition skills and that sort of thing. I think, back in the day, we would just say, oh, that person was kind of odd. Oh, that person is strange. He never looked at me while he was speaking to me, that sort of thing. These days we have a diagnosis for that. We call it autism.
Okay, so autism, with the broadening, and I know that that's a recent thing in the last 15 years or something. They've broadened the umbrella of autism. Autism used to be seen as sort of Down syndrome or something in that category, but now the taxonomy of autism just seems to incorporate everything from mild Asperger's, sort of slightly behavioral. Sometimes I think I'm slightly autistic, and all the way through to quite heavy non-development, in children, where they kind of hit almost an age cap, and they never grow beyond that.
Yeah.
So it's a difficult thing because, of course, like all taxonomies, we make them. Humans make taxonomies. We have a bell curve, and we call the middle piece normal. And somewhere out on the edges, we have whatever's not normal, and then we give new taxonomies to that. And they're interesting ways and useful ways for us to have conversations about, honing in therapies and so forth. So when we look at autism, because it's so broad, how do we deal with it? Firstly, can you cure autism? It's not a disease as such.
Yeah. Some people like to use that word, cure autism. Because some people really see it as an affliction, which is, which has been done to their child. And like what you were saying just a minute ago makes so much sense to me, because there is no clearly defined line. There's no, okay, on this side of the line, everybody's got autism, and on this side, we're all okay. Or, and in the same way, there's no clearly defined line to say that this child has got autism, but he's actually okay and doesn't need that much help. And you should really be left to be happy and to, we don't need to push them that hard. We don't need to put in some crazy intervention to help this person. But this child needs a lot of help. It's very, some kids are very obviously on either side of this line, and other kids kind of fall somewhere in the middle. So, when it comes to kind of helping these children and to deciding what kind of intervention is appropriate for an individual, it really comes down to, or at least the measuring stick that I use, and the measuring stick that I think is kind of like ethically subscribed or prescribed to people who are providing ABA, is that you should be doing what's in the best interest of the child or the individual that you're working with. So you should be looking at what is the problems within that child's life, not what you think you should be teaching that child, and then but rather what is it that is mostly going to benefit that person. If it's not going to benefit that person to learn to read, then you shouldn't teach it to them. Most children and most people will benefit from that, but sometimes that's not what's beneficial. I actually forgot your question halfway through. So
No. But you've triggered me. You've triggered me on something. So the question was around curing, so-called curing of autism.
Oh yes.
But I think you're highlighting a very important thing here, and that is on the spectrum of autism, and for all psychology. I mean, this really touches all psychology, which is what is normal, or functional, or useful, and what is not. So if you're not functioning in society, and as a result of not functioning in a normal way or in a way that is useful, and it's creating something negative for your life, you're being shunned, you're losing, like, you have no opportunities, you're being rejected socially because of some behavioral element of your life, well, then that's obviously not useful. It's something that needs to be looked at, because by improving it, we also improve your entire life. We improve your opportunities. We improve your daily functioning, right? So if we look at autism, it's less about curing autism, whatever that even means, because it's just a category rather than a thing that exists in the world as a disease. And it's more about curing behavior, which is, of course, why you're into a behavioral therapy. It's more about saying, can we make your behavior, can we take this maladaptive behavior that's hurting your life, and can we improve it so that it no longer hurts your life? And that's all we really have to do. Is that the kind of approach you take?
Absolutely. Personally, that's the approach that I subscribe to, and that's very important for me, that I always think in basically exactly the way you just described. I mean, to go back to the cure thing, there is a kind of certain amount of evidence which points towards, if you've got a child of below 3 years of age, and you apply a certain kind of intensive level of ABA, and we're talking about like 30-40 hours a week, that sort of thing, then they've got a very good prognosis versus children that don't have that and are kind of in the same situation. However, in my opinion, the data behind that, or the studies behind that, I think a little bit more needs to be done to really figure out what's going on there. But there is a strong indication that can be done. But and I think in some cases that's the appropriate approach. But I think it's a mistake to grab a kid of 3 or 4 years old and to be like, okay, well, this is, this research study shows that if we do X, Y, and Z, we're going to get here with this kid, or we have a 49% chance of recovery. So that's often what they call this kind of cure, is the recovery. And I think for some children that is maybe the appropriate approach, but you have to look at the individual. You can't just approach that from like, this is what I'm going to do, because what do their family want? What is the child's, what are you seeing is happening with that child? If that child is having severe self-injurious behavior, you really have to deal with that first before you can deal with anything else. What kind of environment does the child find themselves in? What is their kind of socioeconomic situation? Because are the parents going to be capable of doing intensive ABA therapy for 3 years long, paying for somebody to be working intensively with their child for 30 hours a week? Many people in South Africa can't afford that. So that's not the correct approach for them. An individual is not a kind of isolated thing. You have to take the environment into account. So yeah, absolutely. When you're looking at children, I don't look at the diagnosis. I look at what's happening right in front of me, and I'm looking at what are the reasonable goals. And you always want to aim as high as possible, but you still want to be reasonable. What are the goals that we can put in for this child, for this individual, that we think we can reasonably reach? And let's just up that a little bit, and let's just work as hard as is constructive, for that individual, always keeping the individual's best interest in mind. Yeah.
Give me a sense, Philip, of how ABA as a therapeutic method works for autism. Why? And I've done the research. It's definitely one of the, all the behavioral therapies have had the best results in autism recovery. So why is that? Why do they have such good results? Like, give us a sense of what you do in ABA that achieves those results.
Sure. So there's a few reasons or a few things that makes ABA kind of unique and I think a very, very effective approach. Firstly, it uses those principles of behavior. So it uses that cause and effect thing where we have a relatively good understanding of how behavior develops. And that's applicable to anybody or any animal, So it's ABA works with children with autism because it can really work in a very, it can work on anybody if you're applying the correct, you've got somebody with the correct experience and the correct knowledge to apply it within that particular setting. So there's a lot of research been done on how to apply ABA to autism. And I think that's one of the keys to why it's being effective at the moment, is because we put so much effort into understanding what approaches work with children on the spectrum. The other reason it works really well, and this is something that kind of developed through many years of trial and error, and unfortunately some people suffered during this time of the ABA practice making mistakes. But I think we've reached a point where we kind of understand our approaches well enough to know that to kind of avoid a lot of these mistakes. And one of those mistakes was we took a bunch of techniques and we applied it to children, no matter, or to clients, no matter what the kind of prognosis of that client was, or what their behavior looked like, or what their particular problems were. And we just applied these techniques over and over. But what we've learned recently, or like 10 years ago, 20 years ago, was that you really need to individualize to the person. So an ABA program is going to be very individualized, and is going to be looking at what that children or what that client's skills, what skills they're lacking, and what excesses of behaviors which are negatively influencing them. So it's a skill-based approach. We teach skills, and we use those skills to replace these maladaptive behaviors which isn't serving the individual. So if you've got somebody who's tantruming because they want a cookie, we would teach a child to give a cookie. If they can't say cookie, we would teach a child to maybe just hand you a picture of a cookie, because doing that is a much more effective and a much less, kind of traumatizing and a much less aversive experience than crying and tantruming and biting yourself for a cookie. And it's also much more direct. People understand you much better when you're giving a picture of a cookie instead of just screaming in the middle of the kitchen. Do you
think that technique would work on colleagues that have tantrums in the workplace?
Yes, adults are complicated, but when you get right down to the kind of core of it, absolutely. If somebody is screaming at you in your workplace, and you just ignore them flat and don't give them the rewards that behavior is looking for, because every behavior is after a reward, right? Every behavior has a reason it's occurring. So if you just always ignore the person when they're screaming, well, firstly, they're going to start screaming at you louder to begin with. And if you manage to keep ignoring them, then they're going to stop screaming at you after a few days, and maybe try a different approach. Maybe they'll start throwing staplers at your head. That might be more effective to get your attention.
Okay, so you're using like behavioral therapy, which, as you say, has been well researched in psychology. It's still being researched both on animals, things like the prison experiments, the ringing of the bells, just all these many experiments that have taken place that help us understand, cause and effect on behavior. And all of these things have been tested and have very high levels of success in terms of changing behavior. And ultimately, and I know we've had this conversation before, Philip, is, you have to ask yourself the question, what are you trying to achieve? Do you want people to feel good, or do you want them to get rid of the bad behavior? Like, what is the goal, And if achieving the goal of getting rid of the bad behavior happens, have you not actually fixed the problem? just by giving you a life that is more conducive to, you know, collaboration and being with other human beings, you know. I mean, I always say to people that if you were on a deserted island, if a child was on a deserted island and there were no other people there and the child could survive, it wouldn't matter if the child had autism, right?
Yeah.
What matters is that a child has autism in a world where they have to function in a certain way to be accepted or, you know, supported and so forth. And so the maladaptive behaviors work against that.
Yeah.
And
Yeah.
that's what we're targeting.
And the maladaptive behaviors will even go further than that, and it will make it hard to care for that individual. You know, it's going to, not only is it going to prevent the individual from caring for themselves, it's going to actively prevent others from caring for that individual, you know. So at the very least, you know, there's a certain way of applying ABA where you go to somebody, you just identify one goal, and that goal, if that goal is achieved, it's going to hugely improve that individual's, you know, ability to live, their quality of life. And you just work on that for a few weeks, and when that's achieved, you leave again because you've taught this behavior and untaught this behavior, and you've replaced this behavior with this new one. That person's their quality of life is much improved. Like one story, which is unfortunately not mine, but which I learned from my studies, is somebody who couldn't, she couldn't see and she couldn't communicate. Okay. But, you know, and she hated water. She hated the feeling of water. But they had to kind of get her to bathe herself at some stage. And the way they started it is they just had like a bowl of lemon flavored water. And it was nice and warm and hot. And all she needed to do in the beginning was just to kind of get close to this and smell it and maybe touch it with her fingertips a little bit. And that developed into her being able to bath herself, you know. And that, I think, is a very good example of the power of ABA, is the power of a systematic, goal-based approach. And just to also go back to what you were saying right in the beginning, I think it is very easy within such an approach to forget about the individual a little bit, you know, to forget that this is also a person that is got, you know, that's happy and sad, and to rather just see, oh, that's a tantrum behavior. Oh, that's I need to teach them to communicate. Oh, they're doing this, I need to ignore that behavior, that sort of thing, you know. And that's a danger. And I've seen that in my profession where people forget that they're working with a 3-year-old child who really just wants to play a game, and they're just sitting and drilling in behaviors, you know, drilling in new skills. And if, you know, and I think that's what's so important for behavioral therapists to have a very ethical approach. And that's something that's, you know, maybe good to work with other professionals like psychologists or talk therapists or that sort of thing, because they're, again, much more focused on that side of it.
On that internal mind, yeah.
Yes, yes.
So let me ask you this. I'm listening to this and it sounds very intensive. It sounds like the best way to do it would be one-on-one, working with the child individually through the specific goals that you've created for that child. But that sounds unsustainable. That means you need one counselor to one child, and that just doesn't sound like any planet I live on. And it also sounds like nothing a South African could ever afford. You know, to hire a human being with a degree to be full-time with your child also just doesn't sound sustainable. So how does that play out? Is there a way that this can be done as group therapy? Is there a more sustainable way to do this?
Yeah, that's a great question, and I don't think I have a great answer for it. It's a difficult, you know, it's difficult within the South African setting or within a kind of third world setting to really answer that to any kind of level that I feel is satisfactory. But there are a few options. You know, there's a few schools worldwide which have applied ABA principles into the schools and have been very successful in doing so. Morningside Academy in America is one that I really look up to. And something like that, which doesn't exist in South Africa at this stage, and which, you know, would be fantastic to have, is where you take you have a classroom of kids, and these kids can have to some level developmental delays or problems within their development, and but you have one teacher in that situation, and you apply these behavioral principles, and because you're applying these principles, your teaching is actually more effective than it would be in a normal school setting. It's stuff like active learning. We all know that sitting and just listening to a lecture within about 10 minutes, unless that lecturer is really kind of entertaining, but in the majority of lectures, within 10 minutes, you kind of start wandering a little bit and you've got to bring your attention back all the time. But if you kind of have this active participation going on the whole time, it's much easier, especially for somebody with developmental delays, to learn. So that's one way of doing it. When it comes to your very, very kind of severe individuals, my recommendation to somebody with a kind of severe problems, with somebody who's very badly developmentally delayed and has a lot of these maladaptive behaviors, is that we need to find a way to get that person one-on-one therapy, and that's a problem within the system, that one-on-one therapy can't be provided to that person, and you can rant and rave about, oh yeah, the system, etc., but that's really, you get to a certain point where you don't have a choice anymore, where the only thing that's going to work for this individual is one-on-one intensive therapy, but I think there are a lot of individuals that would benefit from ABA being applied within schools, being applied within learning situations, parents being taught ABA, that sort of thing, By ABA is also about changing the environment, like I said. So if we can change the environment and teach people how to apply these principles, if the parents are doing it and the teachers are doing it, you already have your intervention is already a lot more effective on a kind of national level.
Okay, fantastic. I think we've got, I've got just one last thing. Our time seems to have run out. I just want to say, Phillip, it's been great speaking to you. I always love speaking to you. I know that you're incredibly passionate about working with kids. You have the most amazing sense of empathy. I just, love watching how you think about children. You've got an incredibly ethical approach. If anyone wants to get hold of you, I see you have put your number here. I'm just going to repost it on the group. So text Phillip if you would like to get hold of him, ask him any questions. He can guide you, show you the right direction, and he does do this work himself as well. So get hold of him and hear what he has to say. But just in closing, Phillip, what advice would you give to anyone watching this video that might have autistic children? They're listening to you and they're going, I suspect that my child might be autistic. Like at first I thought maybe they were just a bit misbehaved, or they were just being children, but I'm starting to realize they're exceptionally so. They're not quite like other kids. They're behaving in a way that needs some attention, so that it doesn't become something that hurts them later on in life. What would you suggest to parents who have a sense or know that their children are on the autism scale?
So I would suggest that firstly, there is a lot that can be done, and really the only thing standing between you helping your child effectively is knowledge, and training. So if a parent, even if you're in a situation where you can't necessarily afford somebody to come in and do one-on-one therapy with your child, which would be great, you can do it yourself as well to some degree. It's difficult for a parent, I know. I can hardly do it with my own child, and I've got 9 years of experience doing it. But you look for the knowledge, go online, read about it, do a course in ABA. And get somebody to help you, get somebody who's experienced in ABA and experienced in autism to sit and guide you through these things. Get somebody who's there as a support structure for you, to help you with these sort of situations. Because as I said, part of ABA is to teach the caregivers, change the environment. Other than that, if you're looking for therapy for your child, there's various organizations in South Africa where you can, which can provide therapy. Not all of them are going to provide ABA for you, but that doesn't mean that it's not going to be helpful. Stuff like OT and speech therapy can be very helpful for children as well. So you can go to ASA, which is Autism South Africa. Ernie Els Federation does ABA. Star Academy does ABA. And then there's also various individuals about that are providing some level of the service. And I think there's more to come in future. It's going to keep growing. So ABA is really becoming a lot more available in South Africa as time goes on.
Lovely. Phillip, thank you for coming onto the show. It's been absolutely great chatting to you. We are going to record this. I'll send you a link to the video if it's useful to you, for you to use as well in your own work. And to everyone who's attended, thank you very much for coming. We'll catch you later online for a masterclass and other cool sessions.
It's been wonderful.
Cheers, everybody.
Bye-bye.
Thank you. Goodbye.